Hi class, I'm going to present my EBP presentation for Inquiring Faithfully class. My PICO question has to do with major depressive disorder patients, whether cognitive behavioral therapy or antidepressant medications, otherwise known as CBT or SSRIs, lead to a greater reduction in depressive symptoms compared to no therapy at all. The first article I chose is Emotion Regulation and Repetitive Negative Thinking Before and After CBT, which is Cognitive Behavioral Therapy, and SSRI, Selective Serotonin Reuptake Inhibitor Treatment of Internalizing Psychopathologies. In this study, it included 91 participants who were diagnosed with either anxiety, depression, and/or PTSD. They were 45 patients in the cognitive behavioral therapy group, and there were 46 patients in the selective serotonin reuptake inhibitor group. This was a level 2 evidence-based article. Compared to the healthy controls, patients exhibited higher levels of symptom severity, suppression, brooding, and worry. Patients undergoing CBT showed greater improvement in reappraisal strategies compared to those receiving SSRIs. The second article I chose is Non-Pharmacologic and Pharmacologic Treatments of Adults in the Acute Phase of Major Depressive Disorder, a living clinical guideline from the American College of Physicians. So this one was a summary of 65 randomized controlled trials. The guideline focused on adult patients diagnosed with major depressive disorder in the acute phase. This was a level 1 evidence. The result for it was for mild to moderate major depressive disorder, CBT or SGA are recommended as the initial treatment. Cognitive behavioral therapy or a second generation antidepressant as monotherapy are strongly recommended as the initial treatments. Combination therapy of CBT and an SGA is suggested as an alternative if they cannot perform the initial treatment. The third article I chose is the socio-demographic and clinical profile of patients with major depressive disorder receiving SSRIs as first-line antidepressant treatment in European countries. In total, there were 1,410 adult outpatients diagnosed with major depressive disorder. There were 734 patients who received SSRIs as first-line treatments. There were 676 patients who received other antidepressants, including SNRIs, TCAs, MAOIs, and other medications. This was based off of level 3 evidence, and the result was European psychiatrists may preferentially prescribe SSRIs to patients with a more favorable sociodemographic and clinical profile. The most important takeaway that everyone should get from this presentation is that in patients with major depressive disorder, both CBT and SSRI lead to significant reduction in depressive symptoms compared to no therapy at all, based on the high-level evidence of these 3 articles. CBT or SSRI should be offered over no therapy based on the strong clinical guidelines and empirical data. Thank you.